And now something completely different.
Good afternoon. I'm speaking to you live just outside
I like to think balding is just God's way of saying, now let's see you get laid.
Is it true that if you don't use it, you lose it?
What I'd really like to do is put the greatness of this man in perspective.
The hair loss community has a lot to be thankful for, having you as a spokesperson.
You mean you just call this guy up?
About life and about reality.
And now, America's #1 reality radio show for men. Live from Los Angeles, it's Spencer Kobren's The Bald Truth.
Hello, Joseph.
Hello, Spencer.
Guess who I have with me today? Check it out. Dr. Ken Anderson, live in studio.
Hey, Dr.
with me.
Ken Anderson.
Joe, how are you, bud?
Welcome. How are you?
Great.
I am fantastic.
How you been,
Great
man?
Great to see you. Great to hear you. I've been awesome. How about yourself? How's Hotlanta?
Oh, fantastic. Fantastic. It's been a couple years, bud, but yeah, great to hear your voice and great to see you as well. How's Vancouver treating you?
Yeah, outstanding. Vancouver is treating me quite well. It is a beautiful day and just a beautiful life with beautiful people. You can't get any more beautiful than Vancouver.
All right, Joe, you sound too happy. It's the hair loss show, man.
Well,
I'm
LA.
happy to have Dr. Ken.
Well, it's great to be here, and Los Angeles could give Vancouver a run for its money. I miss this place. It's been a great couple of days here.
No, it is nice for sure. But yeah, I'm sounding happy because Dr. Ken's here. Did you even see the thumbnail I made for today's show?
I did real quick. I just put it on the site while
Dr. Ken's all over it.
While I was doing some podcast interviewing with Dr. Anderson, I saw you sent it to me. He didn't even know I was doing it. I was multitasking. I was able to put that, embed this in the site. Guys, let me give out the phone number. It's 888-659-3727. As you know, or if you don't know, if you're just tuning into the show for the first time, if you're listening on iHeartRadio, if you're listening on Spotify, if you're listening to a podcast of this broadcast, I'm the founder of the American Hair Loss Association, author of The Bald Truth and The Truth About Women's Hair Loss. Also happen to be, it's a lot, guys, I'm sorry, the founder of the International Alliance of Hair Restoration Surgeons. And Joe and I are here. I've been doing the show for 24 years, believe it or not, which is insane. Was on the radio for a long time, decided to, just bring it online, which I'm really happy about, Joe. And by the way, I want to thank Joe Tillman, who's the guy in the center, who is the original hair transplant mentor, for forcing me to continue to do the show week in and week out, even though I essentially retired a decade ago.
I forced him because I have photos.
That's wrong. but I will tell you that, there was a long time I was like, you know what? The radio show is over. It really served me well. I don't want to go out there online and do this thing. Everyone's saying you should do a podcast. And I was like, I don't know if I want to do a podcast to record it. So we'll do the live stuff like we've been doing and try to stream it. I have to admit I enjoy doing this every week. So guys, if you are tuning into the program for the first time, this is your place to ask anything and everything hair loss. We've been doing this for a very long time. And today we have a special guest. I'm really happy to have him in studio, Dr. Ken Anderson, who is not a founding member of the IHRS, but one of the long-time members of the International Alliance of Hair Restoration Surgeons, also recommended by the American Hair Loss Association, a guy who's been in the field for about 20 years, almost as long as me, right?
Yeah.
Dr. Anderson?
Yeah. 2003. Early 2003, I got started right here in Beverly Hills.
That's right. I remember that. That's the first year I started in the industry, too. It was 2003. I remember we talked about that in Vegas.
Yeah, that's right.
So I'm really, I guess I'm really the GOAT, as they would say.
Indeed. The OG.
The OG.
The OG.
And that is really sad. It's almost 25 years, guys.
Yeah.
Almost 25 years. Guys, listen, I'm going to give out the phone numbers. Our lines are open now, so feel free to call in, 888-659-3727. We have a lot of stuff to talk about. Inside baseball about the industry. There's an opportunity for you guys to ask questions about anything and everything hair loss. If you're considering surgical hair restoration, this is the place to get completely objective information. We're here to tell you the truth. And, it's unusual for me to have a guest in studio because I don't like anybody in general to be in my place. But I happen to like Joe knows that. I happen to like Dr. Anderson.
Yeah, he's not kidding. He's not kidding.
And, you know, it's unusual to get a different perspective. You know, Joe's been in the trenches for a very long time. I've been doing what I do for a very long time. When I say in the trenches, Joe has been, you know, besides being a 10-time hair transplant patient, he's actually worked for clinics and advised patients during consultations in person. But I've been able to kind of see everything from a 30,000-foot type of view over the years and know where all the bodies are buried, all the shit that's going on in this industry, stuff that kind of surprised Joe when we first started to work together on this broadcast.
Yeah.
Because Joe, you were pretty stubborn about things initially.
Well, I was already coming out of my shell, and I knew I knew some bad stuff. But then when you I'll say awakened me to the reality of what some people in this industry are doing, I thought it was a bad joke. And today, I still wish it was a bad joke because it hasn't stopped. That kind of stuff just keeps on happening, and it's actually worse now than it was when I first learned all about this stuff. The industry itself is worse now than it was 10, 15 years ago.
And guys, I don't mean to interrupt you. Guys, hold on. We will take your calls in a second. 888-659-3727. So guys who are holding on, just hold on. And also, understand this, when all of our lines are full, you're not going to get a busy signal. It's just going to send you directly to voicemail. That just means that we're full. And as soon as we get off the line with somebody, we'll drop a call and you can try to get in. Phone number is 888-659-3727. Go ahead, Joe.
And I would like to jump in. There was someone in the chat room had asked if someone in the chat room can recommend a good FUT surgeon in the USA. You're looking at one on the far left side of your screen right now, Dr. Ken Anderson. He performs not only really high-quality FUE hair transplant surgery, but also FUT strip surgery. He's been doing FUT for a long time. I've seen the work. I haven't had the privilege to look at a lot of the work up close, but everything I have seen has shown me that he's one of the better ones out there, and I encourage you or anyone else to call into the show. You can ask him questions directly about his FUT procedure, his FUE procedure, how he does things, how he thinks, and how he likes his coffee.
And look, if he wasn't good, frankly, and if I didn't feel that he was an ethical guy, and I'm very honest about this, Ken, I don't like people in my space. And I say that, during when there's conferences here in LA, people want to come over. That's great. Yeah. But when I was, with the house in Calabasas, I think maybe I only had Alan Bauman over, and it's a very personal. It's my personal space. Yeah. But to be able to have you here, to speak to you, to get to know you, to know how you treat your patients, and look, I've known you for a very long time. Yeah. Actually, longer than you've been in the IHS. I met you about. It
was 2004.
We were young men.
Yeah.
When we met.
Yeah.
That was an interesting meeting, by the way. But look, we're going to take a call. We'll talk about that in a second. Let's take some phone calls. Hey, you're on the air. Who's this and where are you calling from? Hey, caller. Caller, I'll give you a second to say hi. 3, 2,
Hello.
1. Hey, caller, you're on the air. Who's this and where are you calling from?
It's Morty from Brooklyn.
Morty from Brooklyn. How are you, man? What's going on?
Oh, my God.
Welcome, Morty.
Hey, guys. Yes, welcome. And good to make your acquaintance, Dr. Anderson. Thanks for joining the show. I'm a longtime caller, for those who don't know me. So I'm calling just to say hi to everybody.
Do you really think that there's someone that listens to this show that doesn't know you, Morty?
Well, maybe. You get new callers every day,
We do get new listeners, new callers every day. But in general, if they've ever listened to a podcast in the last 2 years, they've heard Morty's voice.
Anyway, I'm just calling to let everyone know that I'm okay. I actually got the bug which is going around. That's why I was unable to call last week. Really nasty bug. Still getting over it.
What do you mean the bug that's been going around? You got the virus. You got corona.
Yes, the virus. I got the vid. So it was nasty. Still got a little bit of a cough.
So how is that? So how's that Moderna vaccine treating you?
Man, I got a baseball card collection of vaccine cards, and they're about as useless as just about.
Well, look, maybe if it wasn't for the vaccine, you'd be dead right now. You wouldn't be calling the show, right?
This
Good
is
point.
possible. There's obviously no way to know. I got on the Paxlovid thing, and shout out to Dr. Cole, because my regular GP refused to give me a prescription, but Dr. Cole actually gave me a prescription for Paxlovid, so God bless him.
Yeah.
I got at least 2-3 people that I know that have gotten it within the last week, and they seem to be worse off than I am, so I think that may have made a difference.
You know, here's the thing. None of us really know, man. So, I mean, I think it's great for everyone who had the opportunity, especially guys our age, Morty, to get the vaccine. Great. But, sadly, there's a lot of people that I know, double vax boosted here in Los Angeles, and they're sick. So what are we going to do? And Dr. Ken, you're a doctor. What do you think about that? We don't have to talk about the politics of it. I am pro-vaccine, all that stuff. But what do you think about... Are these actually breakthroughs, or is this just going to be commonplace?
Well, I think that the virus continues to mutate.
Yeah.
And I do believe, I am vaccinated myself, I do believe that the vaccines, while not preventing illness, may in fact lessen the severity. And I think it's keeping a lot of people out of the hospital.
And alive.
And a lot of people alive. So I think it's worth your while, strongly considering, especially if you're over 50 years of age.
Yeah, Jesus. When I hear 50, it sounds old, Joe, and I'm going to be 57 in a couple of weeks.
It does. I just remind everyone that it not only helps to prevent death and keeps people out of the hospital, it also helps our alien overlords to continue to track us anywhere we go. So just remember that.
Cool.
This thing on?
So Morty, I saw your hair transplant online, and I got to tell you, I mean, I'm not surprised, but it's looking pretty good, man.
I have to tell you guys that I'm very, very glad that I was able to get it done with whom I was able to get it done and in the way that I got it done, which is slow and steady, doing all my proper research thanks to the IAHRS. I did my homework. I had a lot of different consults with a lot of different doctors, and I spent a little bit of money, and I did a little bit of traveling to make sure that I was able to find the doctor that made most sense for me. I'm also grateful to Joe's list because, again, the doctor I chose is on Joe's list. So, anyone who is planning on starting this journey, remember that it is a journey. It is not a one and done kind of thing. I'm still on it.
And I'm going to say something more, and I think it's important. I hate the whole idea of lists. These lists. For years, physicians were calling the IHRS a list or a website. Now, finally, because we're recognized in Dubai and because of WebMD and because of everything that we've done, we're looked at as a society. That's that's what we started out to be. Joe doesn't have a list. Joe works with certain doctors from the IHRS who he likes and thinks, that he would not mind working on him. So it's not just like a list of doctors.
I think that's a good distinction, yeah. No, I
don't pick your doctors off a fucking list, Morty.
I get it though. No. It's easy to reference it as a list. I understand that, but it's like how do you classify the docs I work with? It's my group of doctors, my group of I don't know. Like how do you reference that? I don't get it. The society IAHRS, I do agree with that. That's easier to throw down, but yeah. We're off on a tangent here. Back to you, Morty. Continue what you're saying.
Now, Morty, I have a question for you. We have Dr. Ken Anderson on. It's unusual for us to have a live guest in studio. Do you have any specific questions for Dr. Ken? Because listen, everyone knows you went to see another doctor in Atlanta, and you had good you had good results.
Yeah. Yeah, sure. I've got some questions for Dr. Anderson. And this is actually, and this is something that I think everybody should do. You should always get a second and a third opinion on anything that you're going to do to your body, put into your body, et cetera, because the more information you have as a consumer, the better off you are. And so I am going to ask a question of Dr. Anderson. Specifically, it has to do with the use of medication. So I have been using oral finasteride, 1.25 milligrams daily, for the last 3 odd years. And I got my prescription from another IAHRS doctor. My pharmacy recently told me that that doctor hasn't renewed my prescription. So I put a call into their office. They haven't gotten back to me yet, which is fine. I have enough pills to get me through the weekend. But just for the heck of it, I reached out to my doctor, and I asked him if I needed, because of the fact that I'm on his topical, whether I needed to continue to take the oral. And he basically said no, which I thought was a little surprising, because the Trico test basically reported an advice to do an oral and a topical. So, Dr. Anderson, what's your opinion on this? And obviously, you don't know me at all, so you don't know anything about my case. But, I mean, maybe you could speak in a general sense about, oral, topical, use them together, use them separately.
Very good.
Please.
Let me ask, how old are you, Marty?
I am 52 years old.
Okay. Well, and I don't know how much hair loss you have. What Norwood stage would you say you were at prior to your surgery?
I'm going to tell you, he's like a Formica top, this guy.
Formica 7.
It was like a full-blown 7, never coming back.
Okay.
High gloss.
High gloss.
High gloss.
Chrome dome. Okay. Well, it's funny. I'm going to go back to
5A.
All right. Very good. Very good. So for the 5A, that's fairly advanced. I want to touch on something you just mentioned to start out with. You said, it's a journey. And that's what, a lot of my patients kind of miss. They come in and I had a guy ask me last week, is there some surgery or something you can do where I can just have the procedure and really never worry about hair loss again? And I kind of chuckled. I said, no. It's a lot like, hair loss is a lot like dental decay, if you think about it. And that's an analogy I use a lot in consultation, because both dental decay and hair loss, they're not diseases. And therefore, there aren't really cures for things that are not diseases. It's a natural variant of the human condition. Both are not diseases, natural phenomenon with no cure, progressive in nature. Of course, their cavities don't come and go like acne does, and they're with you for life. And then fifth, they require, this is getting back to the finasteride question, they require daily treatments, specific and effective treatments to manage effectively. I have patients saying, well, I'm eating healthy and taking vitamins. I said, well, that's great. A lot of healthy people have hair loss. It's still, it's not a disease. So you need to do things specifically for hair loss, just like you do specific things for dental decay. You can take vitamins. That's not going to prevent cavities. You got to brush and you floss, very, specific things. So finasteride is, and for those new listeners, finasteride is one of 3 FDA treatments that are recommended. Finasteride, minoxidil, and low-level laser therapy are the three of the mainstays. I do think that topical finasteride definitely has a place in treatment. You don't get the full effect of the oral finasteride. You get about 75-80% of the effects. The benefits there is that the plasma levels that are in the blood of the medication are much lower. And I find in prescribing the topical finasteride for about the past 5 years, very few complaints of patients having adverse side effects of, the most notable of which is a sexual one where you have a decreased libido. But I think that, preventing hair loss is incredibly important. Hair transplant surgery really is just a redistribution of what happens to be left. And if you have loss in the crown, that's itself a dwindling supply. The dentists almost have it better. I keep going back to this dental analogy, but if you lost a tooth to dental rot, they could put one made of porcelain or whatever they're making it out of these days and put that in the mouth, and it would look and function exactly like a regular tooth. And we don't really have that in hair restoration. It's living hairs are in limited supply.
I don't mean to cut you off, Doc,
sure.
but that's a really important point, because I tell people all the time, they've got teeth down. You may have problems with implants if you needed one, or they may have to give you cadaver bone or whatever to like a graft to hold the implants in. But once that is done, you walk away like you have a full, beautiful smile once again. We don't have that in hair, Morty, as you know. We've been telling you this for a long time. The fact that you ended up getting a transplant, we try to talk you out of that based on, how far you've progressed. This is a hit or miss. Now, if you're going to a good clinic, there's a 90-some-odd percent chance that you're going to do well with a hair transplant, especially if you're on medication. But I think what Dr. Anderson just stated is really important for new listeners, that we're in hair loss it's a different thing. It's a progressive disorder or condition or disease. I call it a disease of the spirit, and it's not a one-size-fits-all situation as far as treatment. And when you're dealing with medication, as you know, Morty, I mean, we just don't know if certain medication is going to work for everybody. So, I mean, I guess your question is, you've been on Finasteride for such a long time. You're using topical as well. Do you think, I guess this is the question you asked, is it okay if you stop using oral, right?
That's pretty much it, because this is one doctor's opinion, and again, I like to get lots of opinions before I make a big decision, and, changing my medical regimen is a big decision.
I know Dr. Anderson has an opinion based on his experience. Let me just give you my opinion based on, I'm a layman. I preface this saying I'm not a doctor. To me, if it ain't broke, don't fuck with it. That's how I feel.
That's kind of what I'm thinking as well.
If you haven't had any adverse side effects all these years, then, and you're doing well with it, then why screw with it? Dr. Anderson?
I concur, doctor. I concur. I think that the topical and the oral would, in my opinion, be more effective than one or the other. I think if you do decide, for whatever reason you want to come off the finasteride, I would taper off of it. I would for two to 3 weeks. I would thinking as well. Yeah, I would for if you're taking 1.25 milligrams or one dose per day, I would for at about 2 or 3 weeks steps, depending on your level of interest. Go down to six days a week for a few weeks, and then 5 days, and then over several months, taper off of the oral medication and keep a close eye on the progression of your hair loss, and all the while you're doing your laser therapy and but I think you're on the right track. Prevention is critical, and really one of the most important, if not the most important thing in terms of how happy you are, other patients will be with their hair long term.
Well, Morty, man,
good question though.
Thanks for the question.
Great question.
And thanks for the call. I'm so glad that you survived this, because, look, we need you to call in the show.
No,
we love you.
Yeah, I'm very grateful to you guys.
Say that again?
I'm very grateful to you guys. I'm very grateful to you guys. And Dr. Anderson, just so that you know, I'm not one of those, home run cases. I've been calling for a little while.
Yeah.
I'm not an easy case, because you're talking about a fairly advanced amount of hair loss, 5A. I wasn't like the perfect candidate in terms of donor hair. My donor hair is fine, and so it was one of those situations where it could easily have gone either way. It could have gone really well, which it did. Or it could have gone really badly. I could have been over-harvested, in which case it would have been a complete nightmare. I could have had a bad placement in terms of where the hairline was.
But listen to yourself, Morty. Listen to what how you're able to preach, man. I mean, when you came to us 2 years ago, you didn't know shit. And now you went in there with your eyes wide open. You knew what the entire scope and the possible pitfalls of surgery. And honestly, I tell doctors this all the time, Dr. Anderson. You want patients like Morty to walk through your door, because God forbid if something goes wrong, they understand that it's cosmetic surgery, and that's always a possibility.
Well, I have a question for Marty.
Yeah.
It sounds like you chose FUE. Is that correct? Tell me, walk me through your decision-making process on that, as opposed to an FUT, which is the linear strip procedure for those new kids.
And before we go on to that, Morty, guys, hold on. We will take your calls in a second as soon as we can get rid of Morty. So it's 888-659-3727. Go ahead, Morty.
Cool. To answer Dr. Anderson's very polite question, Spencer. Basically, I didn't start with what kind of procedure I wanted. I started with the relationship with the doctor. Ultimately, that's the way I decided to do this. I was not in love with one procedure versus another. I wanted to know that whichever procedure I went with, it is a procedure that was going to be performed by a doctor that is a doctor that I want to have a procedure performed with. And then it just happened to be FUE because this particular doctor specializes in FUE. As a matter of fact, he's a pioneer in FUE. If it would have been the other way around, in other words, if it were a doctor that I had met and I had made a good decision based on, IHRS membership, based on Joe Tillman's say-so, based on my own experience of consulting and interviewing with the doctor, and that doctor wanted FUT, I probably would have considered it. So I think that's kind of the way I'd answer that question.
Okay.
Having said that, I kind of prefer FUE because of the fact that the degree of scarring that I've seen, certainly, and of the other patients, is very, very minimal. It's very, very small. I haven't noticed any real scarring. So,
well, it's also because of who you went to. I mean, if you decided to go to somebody else,
exactly.
if you didn't find the bald truth, it's very possible you would have walked away like these poor guys that you see online.
Yeah, with a hairline like Mo from the Three Stooges and no hair in the back. I mean.
Yeah, but see that even the hairline can be fixed in most cases. But once you are over harvested and you have to deal with that, I mean, that is these poor guys. And we're talking about guys in their 20s, Morty.
Oh yeah.
Anyway, we're going to move on. So
sure.
That was a good answer.
One last question, and this is for
always a last question with you.
Yeah.
Okay, go ahead.
Well, it's basically the same question that I was going to ask of Joe, because we know that Joe is also using a topical. So the question to him is A, are you still using your oral with your topical? And B, how did you transition if you did?
I did not transition. I tapered off to completely different issues. Thanks for asking. I brought it down. I brought it down slowly. Similar to what Dr. Anderson was talking about, because that's my belief that if you're going to stop a medication, it doesn't matter what it is, you never want to do it cold turkey, because with regards to hair loss, it can trigger a telogen effluvium of some degree, which we certainly don't want to do in my case, or any case for that matter. But yeah, I just slowly tapered off and slowly added in the topical to where now it's completely replaced the oral, and no difference that I can tell so far. But just like I was talking about last week, I'm concerned about the application of topical only because the particular topical I'm using now is it's a thick it's a thick formulation where it's almost like Arm & Hammer baking soda toothpaste. That's the closest comparison I can make it. It's gritty.
That's good for styling your hair, though.
It's amazing.
I mean, not for me, because I have to do the blow dryer.
I love it.
Donald Trump, the earlier's comb over thing. So if it's a little greasy, you could see right through it. So I can't do that. And then you mix that with the paint.
Found a way to insert that.
Which, by the way, if Dr. Anderson goes into my bathroom, he'll see it. If you mix that with the paint, it's a mess. So whatever I put on my head has to be like dry. It can't be greasy. Yeah. So that's the problem I have with that stuff. Morty, can we take another call, Morty? Is that all right with you?
Sorry, what?
Can we take another call?
Absolutely, guys. Thank you so much.
Morty, great hearing from you as always.
Nice to meet you, Morty.
Same here, guys.
Morty, take care, man.
Nice to meet you, Dr. Anderson.
Bye-bye.
Be well.
Are you able to? Is that computer working?
Yeah.
How is it working?
What do you mean? It's your computer.
Oh my God. He's good. I didn't know I put power into it. I was just like, yeah, you know what? Let's open this up, see if it works, and I guess it's working.
Oh yeah.
Laptops have batteries.
Yeah.
You don't need to plug it in.
Hey, you're on the air. Who's this and where are you calling from?
Hey, it's Mike in NYC. What's up, guys?
Mike, how are you, man?
Welcome,
Mike.
Hey,
Mike, I'm gonna put you over to Joe for a second. And then,
all right, thanks.
All right, go ahead.
Hey, Mike.
I guess I was going to ask a question to Dr. Anderson. It's based on transplant surgery. I don't think it's spoken about too much, but
yeah, go right ahead, man.
One of the concerns about my surgery. I'm just a little going into it, trying to figure out stuff. As far as anesthetic goes, the lidocaine, which is used mostly, what is to be expected, you would say, as far as an ethical good surgeon when that is being administered? Are certain levels of the person's heart rate and whatnot should that be monitored during all that? Because I'm very thin and I'm just lightweight, so I'm just a little concerned about stuff like that. So just what's to be expected as far as the proper way to go when the doctor goes about that?
Okay, great question. Great question, Mike. Thank you for asking it. Hair restoration surgery should not be a painful experience. And so the way that, and you can talk to your doctor about this and be pretty upfront about it, with the medication is called Lidocaine, and, there's different concentrations. I use a 1% solution without epinephrine. I don't think but that's a detail. What's to be expected on your end is it kind of depends, frankly, on the rate of infusion of the drug. So talk to your doctor about this and let them know that you're aware that there's a pretty steep correlation. The faster you inject that medication, the more discomfort is felt, and it's a pretty steep curve there. And so when I do, the anesthesia, first of all, I would also check that the physician himself is doing the anesthesia and does not delegate that. That's important.
Isn't that surprising
in my
that
career.
You're going to have to say that?
Well, yeah, I think that's when you're administering drugs with a needle. I think that in my mind, the way I was trained, I did 7 years of facial plastic surgery training at the University of Michigan, and that didn't even enter my mind that a non-doctor would be doing that, but apparently it's delegated all the time. So just confirm that it's your doctor who's going to be doing it. Hopefully he's using a vibrator, in one hand and putting that vibrator right over the skin where the needle is injecting the medication. And thirdly, he's going slow. The vibrator is helpful because it not only, it's part of the anesthesia itself. It's called the gating theory of anesthesia. And essentially when you provide the same area on the body, on the scalp in this case, with a bunch of non-painful stimuli, a lot of vibration, as well as some painful stimuli, which is coming from the lidocaine needle, it really is processed by the brain differently, and you do not feel as much discomfort. So hopefully they'll have a vibrator there, and they'll simply go slow. Pain is bad for business. Let's face it; it's one of the primary concerns that patients have, and your question is illustrative of that. And really, that's one reason why I do it myself. Frankly, I don't want patients getting hurt, and so it should be a zero. Usually, for some people, it's a 0, but it's a 1 to 2 on a scale of 10, with 10 being the worst pain. It should be no more than a 1 or a 2. Frankly, less discomforting than having your teeth cleaned at the hygienist for most of us. So I wouldn't stress too much about the discomfort in that regard. As if your surgeon's going to go slow and use some vibration, and the nice thing is that the lidocaine, the effect is fairly, a few seconds later, it's pretty good and numb, and usually the surgeon will let that soak in and just kind of take effect for 5 or 6 minutes at least before the actual procedure is done. And so when you're having your procedure done, are you having an FUE or a linear FUT procedure?
FUE.
Okay. So then when that's being performed, you'll kind of sense the pressure a little bit, with each of the graft excisions, but you will not have any little bit of sharp pain. And that's kind of what to look for. I'm very upfront with my patients. I say, if you have, it feels like a pinprick at all, you need to say something, because there should not be anything to tough through. You should be relaxed and in a comfortable position. And when the excisions are taking place, you might feel a little bit of pressure, but there should be literally not 1 to 2, but a 0 out of 1 to 10.
Right.
In terms of discomfort.
Right.
Did I answer your question?
Yes, but the other part of my question was: there's also a correlation between, as far as a patient's weight and how much is administered, and does that get monitored? As far as not being sure to not overdo it and all that. Because, like I said,
how thin are you?
I'm rather thin. I'm about 145.
Yes. I have had patients that are a little thinner, and I would mention that to the doctor. I would also, in cases like this, I definitely use 1%, and I mix it up. I start with a 2% solution, and I mix it up with saline. In this case, I might dilute it even a little bit further.
How tall are you, Mike?
Me, 6'2". I'm thin as a rail.
You're 6'2", 145?
Yeah.
Well,
that's amazing. Yeah,
you get patients like that. That's for sure. But yeah, so I think that unless I think that if they're using not using a 2% solution, and they're withdrawing before they inject, I did have about 10 years ago. I did had a gentleman about actually 135 or so, and I was injecting a little bit more of the medication up in the temporal region in front, just up above the ear. And I believe there was a little bit of a vascular. I injected it possibly into the vessel, and he kind of started feeling funny. But I start an IV on all of my patients. So hopefully you'll have a little IV in your arm, and if there's any kind of if anything goes sideways, which the chances are pretty rare if you're using 1% lidocaine and a small needle and going slowly. The chances are pretty rare anything's going to happen, but if something does, there's an IV access to give. There's a liter of saline that we keep there for the incredibly rare emergencies. But if you're going to an experienced doctor who's done a lot of these, I think that these checks and safety precautions will be in place.
Yeah.
Mike, when are you getting your transplant?
Mm-hmm.
This is going to be at the end of May.
And you're traveling for it, if I remember correctly, right?
Yes, yeah. I'm in touch with the surgeon, and we're going over everything. And this is just extra little homework I'm doing and whatnot. As you know, I'm been kind of anal about everything. So,
and let me ask you: so, are you able to be? Are you in contact with the surgeon themselves, or himself, or herself, or are you dealing with? Okay. And
I know for a fact that what he was mentioning, Dr. Anderson was mentioning there, as far as the injection goes, the surgeons doesn't themselves, and there's also a vibrator involved and all that.
Well, I'm going to be honest with you. It took everything in me not to make a vibrator joke. By the way, I really was struggling not to make a joke. I almost cracked up like a kid. But
we're such children. I swear to God.
I'm like a 10-year-old. I mean, maybe 15-year-old mentally. All right, Mike, any other questions?
Yeah. Well, I had one just side note for Spencer.
Yeah.
Well, it's not about hair loss, but it's hair related.
All right.
As far as going gray, which is starting to happen to me now.
Yeah.
Do you ever have experience with like combing in a little like hair dye when it comes to like sideburns and whatnot?
No, my hair looks less gray on camera than it does in person. I'm probably about 50 to 60% gray, I would say, right? Dr. Anderson? Something like that? Yeah.
I concur.
So the camera, for whatever reason, doesn't pick it up no matter what. I could take a picture.
Yeah.
But I would not, no. To me, because I've been through so much shit with this hair loss thing, I'm just happy that I have hair in my head. So it also makes the comb over easier. And, I don't want to jinx myself, but I have good sides, good, temporal peaks. So, it just flows better when it was darker. It looked thinner, especially in the back.
Right.
So to me,
you know what it is? It's like
it may make me look a little older than I could if I dyed my hair, but fuck it.
I think your hair looks fine, man.
Well, like I said, I'm looking on my camera right now. It looks a lot darker on camera than it does in person. But for me personally, it just seems like that's just an extra pain in your ass in your life that you don't need. And especially if you're dealing with hair loss, I mean, everything you add to your hair, I mean, who knows what it's going to do in the long run? Probably not going to damage your hair, but you never know. You could have an allergic reaction to it. Who knows?
Mm-hmm. Well, yeah.
I mean, is it bumming you out that you're turning gray? Dr. Anderson's gray looks great.
Well, he has a great hairline to go with it, too.
That's true. Touche.
No, it's just the thing is like it's just a little stragglers, so it's not like that traditional like distinguished salt and pepper look going on, and so it's just like if I could prolong it until it overtakes me, so to speak.
You could use if you want to, if you just have stragglers, you can use a little Durmatch. That temporary, it'll wash out, but you can temporarily use it, or some of those spray-on products that you can buy. You can buy them. They have them for women for roots, to dye their roots. Put a little bit on a comb or on a mascara comb, and just put it through your hair. It'll stay on all day.
You could also. Gotcha. I want to comment. Great question, Mike. But there are stylists out there. Shout out to Steve Hightower, the Hightower Salon in Buckhead, Atlanta. He specializes in treating, styling, and cutting hair, of course, men with hair loss, and so he can apply these things professionally. And he's offered to take care of some of my grays a couple of times, but I've yet to, I kind of like my gray. But if that's of concern to you, there are people probably in your city, and you're calling from New York, as I recall, that that would specialize in men with thinning hair.
But knowing you for all these years, 2 years you've been calling in, and you've told me that you suffer from neuroses, and you've been figuring out. I mean, as we all do. I mean, I'm neurotic as hell. You can blame my mother for that, but that's a long story. But if you get something done professionally, and all of a sudden you start to lose more hair, that's going to freak you out. You're not going to know if it's. I'm not saying that it will, but knowing how you suffer with these issues.
Are you talking about the hair dye?
Yeah, you never know with you. You told me that you fucking looked at the Propecia box and you couldn't get it up. Was that you?
No. I I never had a sexual thing with that. I was just nervous about the Propecia, and I had a little a lot of, I should say, like anxiety.
Okay, so you're right. You're the right caller. Okay, I try to remember all the callers, but yeah. So I remember you being you actually saying that you suffer with anxiety. I'm not saying not to do it. I'm just saying less is more with everything. Right now you're concentrating on getting surgery. You might want to concentrate on that, and then as your hair grows in, then you can consider coloring it. Just my suggestion.
Yeah, one step at a time. No, I know. I definitely hear you, man. No, I do. All right. Well, look, thanks for the calls, guys. Thank you, Dr. Anderson.
And you might even be surprised when your new hair starts growing in. It might even be darker, so that might be a solution as well.
You pull back from the mic a little.
Little known fact.
That's true. Good luck with your surgery, Mike.
Yeah. Thanks, guys.
Mike, good luck. Let us know how it goes, all right?
I will, Spencer.
Okay.
Thanks.
Take care. Bye-bye. Phone number is 888-659-3727. Let's see who this is. Hey, you're on the air. Who's this, and where are you calling from? Hey, caller.
Hi, this is Andrew from Dallas.
Andrew from Dallas. Welcome. What can we do for you,
Hello,
man?
Andrew.
Hey, sorry, I wasn't sure if it was me or someone else.
It's all right.
I'm doing fine, thank you.
Good.
Yeah, so I wanted to ask a question about hair follicles and what are your thoughts on whether or not they die, whenever they stop, I guess, growing. Do they like permanently die? Or they're just like in a dormant phase, or because I know that there's times where you can still kind of see like a stubble or a follicle there, and I was just curious, like what happens?
Well, now that we have the opportunity to actually let a doctor answer your questions, let's let the doctor answer that.
Hello, Andrew. How are you doing today?
Doing fine. How are you?
Good. Thanks for calling in. Yeah, the process of hair loss is a bit confusing, and it's not where, and as you correctly noted, it's not where the hair just falls out and fails to come back. All hairs have cycles. The hair follicle will produce a hair for a number of years. Typically 3 to 8 years in a phase of growth called anagen, and then it goes through a cycle, kind of like a pine tree. You walk up on a pine tree in a forest. It has needles on it all year round, but you look on the ground and there's pine needles everywhere. What's the story there? It's the same thing on your scalp. The follicles are continually being created and shed by the scalp, and usually everyone's losing about 50 to 150 hairs a day. Now, in people without hair loss, the hair comes back with the same caliber and the same length of the growth cycle, 3 to 8 years or so. Those hairs, the hair follicles that are subject to the forces of male pattern hair loss specifically, undergo a process that's medically called miniaturization. And what will happen is not only is the hair shaft caliber reduced, the hairs are physically thinner. That's why you can see around them in areas of thinning hair. And the growth cycle is reduced. That means it's maybe not going to be 3 to 8 years. Maybe it's 5 to 7 months. And so you can, sometimes in my patients who have a receding hairline, younger guys or really any age, you can pull the hair back, and there's little hairs about 3/4 of an inch, inch and a half long that, of course the stylist or the barber didn't cut them there. That's an area of active hair loss. And so what will happen over time is the follicle tends to what we call, or what is called, it burns out, essentially. The hair produced by the follicle gets smaller and smaller and smaller, and eventually doesn't produce any hair at all. I mean, it goes, down to, like hair on a woman's forehead. It's there, but you'd almost need a microscope to see it. But eventually hair follicles do stop producing hair after, the process of miniaturization is complete. It's not exactly a death thing. It's just a transformation of the hair follicle itself.
Okay. Yeah, I was just wondering because it's commonly said that DHT is the main culprit for hair loss, and you would think that if that's the case, then everybody on medication should be able to recover their hair, at least the majority of it, if that truly is the number one culprit.
Well, don't forget, my friend, that there are 3 different enzymes that make that DHT is a product that is a molecule that is made from testosterone. And so there are 3 different enzymes. They're all called 5-alpha reductase, and there's 5-alpha reductase type 1, type 2, and type 3. Type 3 makes a negligible amount. Type 2 makes about 65% of the DHT, and type 1 makes about 34.5% of the DHT. Now, the medication that's FDA approved and most commonly prescribed for hair loss is Finasteride, or Propecia is the trade name. Mm-hmm. That's going to block just the 5-alpha reductase type 2. And so that doesn't take away the DHT entirely, and you don't want that. DHT is an important hormone in other areas of the body. It's kind of like the super testosterone. It's like testosterone, but a much more powerful. It's about 1,000 times more powerful than testosterone, and it's responsible for a lot of the things that make us manly men. And so you don't want to drop typically your DHT to 0. And so the DHT comes down by about 60 or 65% when you're taking finasteride. The other medication that is out there is called dutasteride. Avodart is the trade name. And that blocks both type 1 and type 2 and will reduce the DHT levels much lower. And so that's what's available. It's not recommended for hair loss. It's more of a drug for prostate gland enlargement. But to directly answer your question, it's not going to reverse the miniaturization effects. Once the miniaturization has, to whatever degree, has occurred, reducing the levels of DHT typically, not always, but typically doesn't reverse the process. It kind of just leaves it where it was. There are some patients who, especially younger patients in my practice over the years, I've found patients under the age of about 30 who jump on, who are prescribed finasteride. Sometimes they can grow hair back, sometimes substantially, but that's the exception as opposed to the rule. And I find that if you're over about the age of 30, simply using finasteride alone is not going to bring the hair back or make, reverse the miniaturization process, make those growth cycles longer and the hair shaft diameters thicker.
Yeah. Okay. Yeah, I was just wondering because I made one of the biggest mistakes by stopping dutasteride. I was on dutasteride for a while, and then I thought I had experienced side effects, erectile dysfunction, and so I thought, okay, maybe it's the medication, and then I stopped it, and I thought to myself, well, if I need to get back on it, like if my hair gradually starts to thin, I'll just get back on it and recover whatever I've been losing. I didn't think it would be too big of a deal, too bad, and it really didn't really notice anything until right about the 5th month, and almost all of it just happened at once. And it was like, and then at that point it was a little too late, because I thought to myself that maybe I would notice the thinning like gradually, and then I would just get back on it. But little did I know that it just all hit at once, and I was just kind of devastated.
You went through a pretty typical telogen effluvium, where just the hair just starts to kind of, it's synchronized and just essentially falls out pretty quickly. That's not uncommon.
Yeah. Well, it sounds concerning to you, Mac. I can hear the pain in your voice.
Yeah, it's pretty. It was pretty bad, and I jumped back on Dutasteride. I've been on it for about a year now. I still have hair on my head. It's just very, very thin, and so that's why my question about like hair follicles and then the cycles, and because if you would think that if the hair follicle is still alive, if it's still producing, that maybe eventually it would recover, but maybe I'm not giving it enough time. I don't know, but I also don't know if this is the best it'll get. Like, I still have hair on my head. It's just very, very thin.
Yeah.
So it's like a lot thinner on top, and so I was just wondering if maybe I need to give it more time, or if once it gets to a certain point that it can't recover.
Yep.
I don't really know.
Well, let me ask you a couple of questions. May I?
Yes.
How old are you?
I'm 31.
Okay. And what else are you doing to prevent your hair loss issue?
What else? Well, so I've tried a lot of things. I've tried microneedling, minoxidil, but currently I've also tried a topical finasteride, which was the more F5 or whatever from India. I think that was years ago, but I feel like that did help a little bit. But then I really think that when I was on Dutasteride, that really helped a lot. Yeah. And but once I stopped it, made a big difference. But currently, right now, I'm also, in addition to Dutasteride, I'm also, and this is controversial, I know. Forgive me for it, but I wanted to try it out because I've been on Dutasteride trying to recover what I had lost. So I got on RU58841, the topical anti-androgen, in hopes that maybe in combination with 5-alpha.
The only thing that's controversial about that is we don't know where the hell you're getting it from. It's all gray market shit. You don't know what you're putting on your head, and if it actually is RU58841, because that really hasn't been manufactured for 20 years. I mean, at least manufactured to the point where you don't have to put it together in a bathtub.
Yeah, I agree with that, and I know that there was a time where it was said that it was very successful. At one point, there was different studies, phases, but then all of a sudden they stopped and disappeared, and didn't explain why. But just like we talked, or I've heard you mention before in the past about the forums or people, rumors. It's commonly understood that RU58841 can be an alternative or an effective product. I just decided I wanted to try to do everything I could. I did notice, though, that I started in January this year. Did notice that it's almost like my hair started thinning again, but I'm thinking it ties back to the hair cycles, like you said earlier, that they kind of synchronize and you go through a shed. So I'm thinking maybe I'm going through a shed, which is kind of interesting to me too, how when you start medication, like you experience a shed, it's commonly associated with the shed.
Well, I want to make a comment about that, and that is that if you start a treatment for hair loss specifically, like whether it be minoxidil, low-level laser therapy, things like this, a little bit of a shed is kind of a sign that it's actually impacting the hair cycles, in a positive way. So I counsel my patients, if you start low-level laser therapy, or if you start the topical, I offer a finasteride minoxidil mix at my practice. It's got some retinoic acid in there and some other and some ketoconazole, all of which have been found to prevent and sometimes reverse male pattern hair loss. If you notice that a little, guys are really concerned about that initial shed, the reality is that's actually showing you that it is modifying the timing of the hair follicle cycles and can be a good thing. I just want to also add that you may consider, speaking to a hair restoration surgeon, hopefully someone near you recommended by the International Alliance of Hair Restoration Surgery, about PRP procedures and possibly exosomes. Exosomes are a stem cell-like therapy that has shown some real benefits in some patients, and that might be something that you would want to explore to kind of help reverse that process without surgery. You're kind of, you're a little bit young to be considering surgery at this point, so I would exhaust your options besides surgery to try to push off a hair restoration surgery for as long as possible.
Yeah, definitely want to avoid that.
And listen, I just want to point out, and this is just my opinion based on just speaking to literally tens of thousands of guys just like you over the last 25 years. I have known people who've gone off their meds, and they felt they had side effects, and then they realized maybe they weren't having side effects. They got back on, and during the time they were off the medication, they went through a telogen effluvium. They lost a lot of hair, maybe even worse or back to baseline. I've known people who have grown back a significant amount of hair as long as it was done within a year or 2 year time period or 3 year time period. Mm-hmm. So I don't want you to think that that you're just out there, out to dry because you decided to jump off medication, you had a bad experience. It is possible that you could recover. I'm not saying it's going to happen. We have no idea, but the possibility does exist. So I want you to kind of keep that in mind so you're not totally bummed out.
No, that does give me a lot of hope. It's just, and I just want to put this out there just for anyone that's listening. And you hear it a lot out there on the internet, but I went through it, and I'm just an average person calling in, just like everyone else. When I was on the medication, it was almost like I had no hair loss. Like to the average person, they would have never known. I would say that's probably the biggest mistake I ever made, was kind of like underestimating the power of the medication. And right around the 5th month is when I learned the hard way. And my head, it was almost down to the skin. There was just so many gaps everywhere, hair, and I've recovered some of it, but like I said, it's very thin. But I would say that's probably the biggest mistake I made. So definitely don't get off of it.
Well, don't beat yourself up about it, because you especially since you're spending time on the internet. A lot of guys, they spend a lot of time online, and they're reading about these adverse side effects, and even if they're not initially experiencing the side effects, sometimes they psych themselves out, and they start to experience the side effects. Or maybe I don't know, maybe you're out drinking that night and you just couldn't get it up, and you're blaming it on the drug, and that's not uncommon either. But I do think actually. Go ahead.
I was just going to say that when it comes to that, it turns out that now looking back, which was very dumb of me, but I was actually working a lot, so I wasn't sleeping very much. I was probably averaging 4 to 5 hours a night, and I was tired. And I looked it up, and sleep deprivation causes erectile dysfunction.
Anything can. If you think you can't get it up, you can't get it up. It doesn't matter if you're functioning normally or not. As soon as that adrenaline kicks in a little bit, and your mind is like, "Oh, this is not going to happen," it doesn't happen. So
go ahead. There was a time where I did think that there was side effects. Before I started, I was scared, but then I got on it, and I was like, yeah, this. I don't notice a change at all.
I just want to make it clear to everyone who's listening, and especially for all the the people who are saying we're Merck shills or whatever. Side effects do exist, for sure, and the possibility of adverse long-term side effects seem to be a reality for a real small subset of the population. However, most men who take this drug seem to do pretty well on it. And the majority will see some success as far as their hair loss is concerned, with very minimal adverse side effects. I've been on the drug for 30 years, and I got to tell you, if I couldn't screw, I wouldn't have been on the drug. Now, have there been times when, I'm an older guy where I had a little bit too much whiskey and all of a sudden things didn't work out? Yeah, but I said, you know what, I drank too much tonight. That's all. Then everything went back to normal. So these things happen. And this is not for you. I understand your case, but for those who are listening, who are hyper-focused on always pointing to the drug for whatever happens in their body. That's not necessarily the case. And I'm sure Dr. Anderson counsels a lot of guys who are just like, I think I'm having side effects, and maybe they're not.
Well, I want to point out, Andrew, it sounds like you're doing a lot of this, or at least some of it, on your own. Hair restoration surgery is an interesting field in that typically, if you can, we don't charge for consultations. I mean, I know that's just kind of a thing in America. I know in other countries there is a charge to see a physician about hair loss, but that really isn't the case here. And, if you can find a physician that, cares about their patients, a lot of times it doesn't cost anything to see them. And I don't charge for my consultations, and I care about my patients. And I want, and just like I can hear the concern in your voice. A lot of times you can, make an appointment. An ethical surgeon is not going to try to sell you a surgery. He's going to try to counsel you on the different ways of hair loss prevention, because you're only 31 years old. You've got decades of living to enjoy, but you've also got decades of hair loss to manage. And so a good surgeon will recognize that. A good hair loss specialist, hair restoration surgeon, whatever, and will counsel you in the different areas and other treatments you might consider. Like I mentioned, PRP and exosomes may be of use to you, especially because of your age. You're a young man, and the hairs still are there, and PRP and exosomes have been known to thicken up hair that is still there but in a miniaturized state. So I would, maybe look one of these guys up. We do virtual consultations, whatever you like, and talk with them about your options, because you'd want to do that before they're, it's not going to happen suddenly, but it takes years for follicles to finally burn out and stop producing hair. But feel free to utilize the physicians that are out there who specialize in hair loss and hair restoration surgery.
And look, man, just hang tight. There's a possibility, even with what you're doing right now, that you can get back to where you were.
Absolutely.
I'm not saying that's
it's possible.
That's the case, but it's possible. All right?
Yeah, no, I appreciate that. Yeah, I appreciate it, because I've used a microscope, and that's probably another level that most average people don't. But I was looking at the follicles, and I see them. I can see them, and they're at a decent caliber. They're just, some of them are like longer than others, and even though
so you got yourself a digital microscope when you're putting it on your phone or on your computer, and you're checking out your density in your hair follicles.
Yeah, they're actually pretty cheap on Amazon. They're probably about $30.
Oh, they're super cheap. I actually I was advising physicians during the pandemic that if they really wanted to get a good assessment of their patients, they may want to offer that with their online consultations and send them an inexpensive digital microscope. And a few of them decide to do that. It really helped them.
I recommend it too. I recommend it just so you can kind of see what the eye cannot see, and then you get a close-up look at what's actually going on down at the skin.
All right, man. Well, listen. I'm going to cut you off because we get a lot of calls, and I'm glad we were able to help you. I hope we were able to help you, and we're here every week, man. So let us know how you do. I have a feeling you're going to be okay. So just be patient and have confidence in the fact that at least you've taken action again and you're being proactive.
Thank you very much.
All right, man.
I will keep you posted.
Good luck. Hang in there.
Good luck, Andrew.
Thank you.
Take care.
Thank you very much.
888-659-3727. Hey, you're on the air. Who's this and where are you calling from?
Hello, can you hear me?
Yes.
Yes.
Oh, hi. Yeah, this is Wayne. I'm from Pennsylvania.
Hey, Wayne.
I called about
Hello,
a
Wayne.
month and a half ago.
Okay.
Hey, how's it going? So, yeah, I called about a month and a half ago. I said I had my first hair transplant back in 2019 with Dr. Sinek from Istanbul, Turkey. And I was not 100% happy with it.
Yeah.
And then I just talked to you about my possible revision, and I was thinking about eugenics with Dr. Bansal. Well, anyway, I did have the second hair transplant in India. I was there about 2 weeks ago.
Oh, really?
And I'm recovering from it now. Yeah,
All
I was
right.
in India. I was I went to Mumbai first for 6 days, and then 2 days in Gurgaon for the hair transplant, another 6 days in New Delhi. But that country is extremely impoverished. I've seen newborns on the side of the sidewalk, literally like a foot or 2 feet from the edge of the sidewalk. And what if somebody steps on it? What if there's like a moped or a scooter that runs over it? The Mumbai is just so packed. I mean,
So how'd you feel about having surgery there?
chaos. I thought it was fine. I mean, they call themselves like a state-of-the-art facility, but by American standards, it's pretty standard there. It's not like high tech or anything like that. But no, I don't have any problems with.
Who'd you go to again? You went to eugenics?
Eugenics.
Say again?
You went to eugenics?
Yeah. Yeah, in Gorgon, near New
Well,
Delhi,
so
India.
tell us about the facility. I'm interested. Now, obviously, they're part of what we do in the IHRS. They have a really good reputation for.
Well, they have their own building.
For that part of the
It's
world.
their own building. They
That I
own
know,
it
yeah.
outright. It has several floors. And when you enter the building, they want you to be wearing slippers or some Crocs, so you're not wearing your own shoes in there.
Right.
And then when you're having your surgery, they make you take off any shoes you have. You're barefooted, and then they do offer you a blanket, which was a nice touch because when I had my first hair transplant with Dr. Sinek, I was freezing in there. I was shaking and shivering, but having that blanket really provided some warmth and comfort to me. And then, like what Dr. Ken Anderson said about the anesthesia, they use this like a vibratory equipment, so it kind of distracts your mind. And when they injected the lidocaine into the scalp, I really didn't feel it. When I was with Dr. Sinek, they poked that massive needle. It was like, stabbing you with a butter knife, and it was so painful. And then they say, hey, if you want that that air gun approach, they were going to charge me 350 euros. So I said, no, I'm not going to pay that.
They were actually going to charge you. Well, I mean, you went to a clinic.
Yeah,
you went to a clinic
for less pain.
You went to a clinic, and you wanted to save some money too. So they figure, you know what?
Yeah.
We're only going to charge you these many euros for, better application of anesthetic, which is insane to me.
Yeah, that's outrageous.
It isn't outrageous.
Yeah.
I hear this all the time, man.
That's wow. Well, things.
Yeah, so.
We'll do the surgery, but if you pay us some more money, we'll make sure you don't have any pain.
How much is the
That's how it
air?
works.
Yeah, and if you pay us a little bit more money, we're not going to throw away these extra grafts that we took out of your head. Now that's not that's not a hair transplant tourism thing. That used to happen right here in Los Angeles and in a clinic in New York back in the day.
I heard about that.
Yeah. They throw your grafts away. Oh, and they go up to you during the surgery.
When you're sedated.
When you're sedated, they want you to put it on your credit card.
Yeah. Here's my card.
Yeah.
No, make me not feel any pain.
Yeah.
But yeah, they didn't. At eugenics, they didn't charge me for it. Nothing extra for it. And yeah, you're right though. I mean, it was painless. I mean, it really was. I mean, compared to having that syringe poked into your scalp, it was like 10 times less painful. It was pretty comfortable actually.
Well, that's
and
good.
now I can understand how people have back-to-back days of hair transplant. Before going to eugenics, I just couldn't understand it. Why would people want to put up with that tremendous pain 2 days in a row when
Well, no one wants to put up with that pain.
one
It's just different clinics have a different standard of how they take care of the patients. It varies widely across the entire spectrum of clinics. Some or most, as far as I know, have brought in the vibratory aspect of diversion from the pain while they're administering the anesthesia. But there's still clinics that don't do that. And you got some clinics that will use I forget what it's called, but it's a machine that will actually do the injections automatically. They just run it across the skin, and it's injecting into the scalp with anesthesia.
Yeah, that's what he was talking about.
Others will do it with a standard syringe.
That the first Turkish clinic wanted to charge him $350 for.
Yeah, I heard that. I know.
Yeah.
Yeah, but there's all kinds of differences from clinic to clinic. There really is.
So so you went in. This is a repair surgery. So what was the assessment when you went in to get repaired? Now, who did you see? Which doctor?
Dr. Erica Bonsall.
She's great. I happen to like her very much.
She was nice.
She has a great attitude.
She's
She's
from my hairline.
Very professional.
Yeah, mellow person. But I think there's some asymmetry, but that could be my fault, though. I shouldn't have done it. I sketched out my hairline with a piece of paper. I folded it in half and make sure that it's the same on the left and the right side, just so I can have a symmetrical hairline. And then she drew the hairline for me, and then I placed that little piece of paper onto my forehead. And then I noticed that the left side temporal point was a little lacking, and then she drew a little bit deeper. And now, looking at the mirror and taking some pictures, it seems like the left side.
Dude, it hasn't even grown in yet. You don't know what you're going to get. I mean, there's always some degree of natural asymmetry.
Absolutely.
And that's probably, and maybe Dr. Anderson could speak to that, but I would say that's probably what you want to go for to some degree.
Yeah, I call it getting funky with it. You kind of just, symmetry is a general goal, certainly, but you'll find, like I'll be talking with patients, and especially when I'm doing their hairline, I'll line it up and I'll say, do you know one of your eyebrows is higher than the other? And they had no idea. And then I show it's easy if you take a picture, because it turns the 3D human head into a 2D picture. And I say, carefully look here. You can see one eyebrow is high, and then one ear is bigger, or one ear is located higher, or one of their natural temporal points is, even on my own head, I forget which side is which. But when I got into hair restoration surgery, I of course had a good look at my own hair. And my temporal points one's almost an inch higher than the other on one side. And my whole life I went through not knowing that. So that's, when in my fellowship in facial plastic and reconstructive surgery and the cosmetic portions of that, and it also applies to reconstructive surgery of the face, symmetry is definitely a general goal, but absolute symmetry is not really something to be held in absolute regard in terms of the surgical outcomes. So, because really, especially with hair, you want the hair to look like it's always been there and not like somebody put it back. So there's a sort of an organic presence to it. So I think that was an interesting idea to use a piece of paper to kind of ensure that you had general symmetry. And I think it's once you let I understand your hair is not even grown in. It's only been a couple of weeks. Yeah, I wouldn't worry about it for another year. I know I don't think you're going to notice any issues if it was even close to symmetrical. You're going to be happy with your result.
Yeah, like what you were saying though, the best way to detect asymmetry is to take a picture of yourself. And I've been taking pictures of myself.
Mm-hmm.
I can notice the asymmetry. And I do have a lot of asymmetry. My left eye is lower than my right eye.
Mm-hmm.
My right eye is a little bit farther away from the center line. My skull is asymmetrical. The right side is a little bit receded. I see some lumpiness on the back of my head, and the way how
holy
my hair
shit,
grows
man! You're really assessing yourself.
Yeah,
I was going to say. So you notice the asymmetry is what you're saying.
Yeah, I do.
Yeah.
Yeah.
Well, it's normal. Totally
one thing
normal.
I tell people is. One thing I've told people for years is that you can't expect an actual symmetrical hairline because your face isn't symmetrical, your body's not symmetrical. All you can do is just get it as close as possible, but it's never going to be actually symmetrical. So what Dr. Anderson was saying, it's completely spot on, and you're saying it yourself, like you're noticing all these asymmetries about other parts of your head and your face, then your hairline can't be symmetrical either. So it's just something. It's just something you deal with, and your shape of your face and your hairline, it'll all work out in the end, unless it's like inches difference. Like one temple's 3 inches further back than the right. If it's like that, then you got an issue. But if it's not like that, then you're probably fine.
Yeah, and when the hair grows out, it's going to be it's going to look much different. Especially since depending on how you style it, where you part your hair. And, frankly, there's sometimes even a reasonably significant asymmetry in a hairline, especially if you're parting it on the side that's higher. That could look kind of cool, So, I mean, it really depends. I know guys who haven't lost a single hair. And if you actually went up to their hairline, you'd be like, holy cow, I had no idea how, what a degree of asymmetry there was. And when you see these guys with really symmetrical hairlines, they look kind of weird. I'm not judging, but it's unusual. Let's put it that way. So I wouldn't worry about it. I mean, go ahead, say it again.
I don't part my hair anymore. Ever since my first hair transplant, I spiked my hair up. That's the only way it looks good. When I part it, I see a lot of discontinuity in terms of the hair density. There's like large patches of sparseness at the parted area. It just doesn't look right. So I just
well, let me ask you, and I think this is important for newer listeners who are considering having a hair transplant or going to a different country to have a hair transplant. What degree, like how dissatisfied were you with your first hair transplant? And I ask you this because, and I mean, Dr. Anderson may have heard me say this on the program, but really in this market, I can say, based on all of the complaints and emails that we received through the American Hair Loss Association, the IHRS, and the Bald Truth, it's an estimate, but I'd say 7 out of 10 hair transplant patients range from dissatisfied to disfigured in today's market. And that seems like a lot. That only 30% are super happy with their first result. So were you dissatisfied? Were you somewhere in the middle? Did you feel like it looked unnatural? Did you just want more density? What was your situation?
Well, from my first phone call, I would give my first hair transplant with Dr. Emra Sinek a grade C. It was okay.
All right, that's I got to tell you, you're one of the lucky ones. If you got a C, if you're giving him a C, you're one of the lucky ones.
It's been more than 2 years now, and I think I realized the final result already. It's not going to get any better, and it's probably not going to get any worse because I'm taking finasteride daily on 1 milligram dose. And then the doctor finally said, hey, why don't you come into the office? We can do a revision for free. But then I talked to Dr. Ponsella, and she told me that your hair density is not high. There could have been some transection. And from that, I then talking to you on the phone the first time around, you said, hey, would you rather have a free surgery or would you rather pay up some money and get some excellent results? And, based on your analysis...
Well, I'm really smart.
Go with eugenics.
It's good advice.
I guess you are. That's what I did. I went to eugenics.
Well, listen, I'm sorry that I forgot some of your story, and we get a lot of callers, but I'm glad that you went to a facility and a clinic that if you're going to travel, if you're going to go so far out of the country, then that is one place that provides really great service, and they're not cheap either. That's the thing.
Oh no, not by Indian standards. I mean,
no, you're not going to like a $1 or $2 graft
99% of the people in India cannot afford it.
That's right. Yeah. That's right. And we try to avoid, especially in the IHRS, we try to avoid these guys who are really lowballing, not only in different parts of the world, but in this country as well. We cannot commoditize. This is such I was telling this to Dr. Anderson earlier, such a difficult and nuanced, this elegant form of cosmetic surgery. To turn it into a commodity, you're going to have to cut corners. And anyone who's really great at what they do, they're not going to do that, in my view. So there you go, man.
I mean, if you want to get a hair transplant, you have to go to a doctor that specializes in hair transplant only and not go to a cosmetic surgeon that does rhinoplasty, facelift, breast augmentation, and a medley of other things. You need a doctor that's solely dedicated towards hair transplant. That's the best way of getting the best result.
I absolutely agree to that. I agree with your opinion. That's a solid opinion. Hair restoration surgery is its own specialty. It's got its own board. You
need a team of people working with you.
Yeah, who do it every day.
I mean, it's very time consuming.
Another thing I would look for in a hair, with the different changes in the specialty, and a lot of doctors, cosmetic surgery doctors who perform rhinoplasty, breast implants, own a med spa. There are a bunch of med spas popping up that are now offering or portending to offer robotic hair restoration surgery. I would look. It makes it a lot easier, at least from my perspective, to separate, the players from the pretenders, and that is do the surgeons perform both FUT and FUE? I think neither's a panacea. I think FUE, I've been doing FUE since 2004. I started in Beverly Hills here, and we initially thought it was going to be just, to get hairs to put into other scars, and then it kind of transformed into this entire other animal because there's instruments around it, and there's patients will pay more for it. But the linear FUT still has a lot of use. It is the gold standard to which FUE, all other methods, including FUE, should be compared. And so if there are exceptions, definitely. There are doctors out there who specifically specialize in FUE. But I think by and large, if the doctor does not offer FUT, you might have a closer look at that doctor, because the ones of us that are very serious long-term hair restoration surgeons absolutely still have a portion of their practice where we offer FUT, because not everyone wants an FUE, and it's not applicable nor appropriate in every situation.
I think that's... It seems like there are different schools of thought on it, though. The now retired Bill Rasmussen says FUT is the gold standard, even though he claimed that he and Bernstein co-invented the FUE method. And then
I would say I'm gonna have to correct you on that. The Bob Bernstein named FUE, and Bob and Bill did publish the first paper.
Can I interject right there?
Well, you know what you're talking about in this one.
Who was the surgeon on that first paper?
Apparently it was you.
It was me.
Yeah.
I used to practice. Yeah, I used to practice with Dr. Rasmussen and Dr. Bernstein. They were in the same practice together. And this is on April 1st, 2004. It literally was based on almost a dare, like all of Scottish cuisine is based on a dare. but I was offered.
How dare you say that about haggis?
Haggis. But I was offered Dr. Rasmussen said, if you can get, because we didn't have any instruments. All we had was disposable plastic with a little metal end, these Miltex biopsy punches, 1 millimeter. And he said, if you can get over 1,700 grafts, this would be, and ended up being, the first formal hair restoration surgery procedure performed with the FUE method. He said, if you can get over 1,700 grafts, you get a free long weekend in Palm Desert. And I was a young man, and with a lot of energy. I started extractions at 6 a.m., and no kidding, it took me until Dr. Bernstein was in New York and Dr. Rasmussen was elsewhere in the building. But I sat there with those technicians from 6 a.m. until 11:30 p.m. Took me 17 and a half hours to extract. And I at the last 3 hours, I said, you can stop telling me I'm just going to go till I can't go any. And we did 1,901 follicles. And at the time, after I finished that, I had to take a couple days off. It was very arduous, and I thought, we all thought, there's no way that this will ever be an actual thing. And but there was, and the patient himself, he was a Green Beret, legitimate Army Green Beret, and it's a good thing because we had him in a seated position for those 18 hours. And yeah, but it's come a long way with the advent of all the instruments, and it's kind of, we always thought it would just be a sort of a side method to get hairs to put into, frankly, FUT scars,
right,
or for guys who were in the Army or who actually was soap opera actors back in the early 2000s who maybe would get a role that would require them to shave their head for a military role. But it's surprising to some of the older generation of hair transplant surgeons that FUE has taken such a front seat in the specialty. But I agree, FUT is the gold standard.
Well, what's surprising is, and I don't mean to cut you off, what's surprising is that the history of FUE has been completely rewritten, and most of what you read out there is complete bullshit. And I tell you guys this all the time on this broadcast. No one, this is probably the first time that anyone ever heard that it was Dr. Ken Anderson who performed that first big FUE surgery that was essentially a key factor in Bill Rasmussen and Bob Bernstein writing that paper. Did I phrase that correctly?
Yeah, they had. I was in my first year with Dr. Rasmussen, and so I did the surgery, and they wrote the paper. They did include me as an author on the paper, which was nice. But yeah, that's currently in the the 2004 ISA, the forum.
And you know,
ISHRS publishes.
While Bill was having you do that work, or before that, you know, maybe even before you started to work for him, him and I were on the phone having conversations about the Woods technique, and him saying that it's absolutely impossible that they've tried it. They're not even going to. There's no point in even doing it. Bob Bernstein told me the same thing. I'm like, listen, guys, this is a reality. I had someone in the studio that I was in New York at the time, who's, you know, I've never seen anything like this. I think it's a great adjunct procedure. Canadian doctor picked it up, started to promote it on an old message forum called Hair Loss Help, with the help of a guy named Pharaoh Mann. And, you know, I said, look, this guy's he's crushing it. People want this. If you guys can make this happen, you should. So it was John Cole, it was Alan Bauman, it was Dr. Anderson with, you know, while you were working with Bill Rassman. Bill saw this happening, and he's like, I got to get a paper out. But he had told me, point blank, there's no way this is going to work. They've tried it, it doesn't work.
Well, I think it was the instrumentation. I mean, I would go through these boxes in that case, and you'd get a box, and I would just have I had a great staff, actually, to support me on this, and which is always important. But I would, you know, for some of these punches, you would be able to do 20 follicles. And other ones, you'd do one. I'd be like, throw it out, and I'd go through an entire box, throw it out, I'd try one, and you could just tell it was too dull. So we didn't have, you know, the instrumentation was in its prehistoric, embryonic stages at the time.
Sure. Well, I'm glad that they decided to take it seriously, that you were there to help them make that happen.
Yeah.
But it's a double-edged sword. It's a double-edged sword because the reality is, I think that while I was a big proponent, I was able to, you know, introduce the Woods technique to all the doctors in North America and then in Europe. We created a lot of monsters. It destroyed. I mean, I never in a million years thought the field would turn out like this.
Yeah, the pendulum kind of almost went too far.
Completely.
Yeah.
Completely. So now the barrier to entry is incredibly low. People aren't really investing a lot in the infrastructure of their practices. You know, it's a mess.
That's a good point, because the barrier to entry used to be whether or not you had the surgical training and skills to perform an FUT. Right. Which is complicated and can be dangerous in untrained hands. And that doesn't exist anymore. You know, you don't need to be a facial plastic surgeon to offer FUE. You know, you don't need any.
Well, apparently you don't need
any
surgery
training whatsoever. Well, yeah, and in some clinics that is the case.
But it's interesting because it kind of, you know, it evolved to the point where you needed to have that infrastructure. You needed to have that surgical skill set. But initially, when it was Norman Orenreich and the Youngers and, you know, all the original guys, you just needed a punch.
Oh, yeah.
So it eventually evolved into becoming an actual surgical procedure where it took a good skill set.
Isn't that interesting? Comes full circle downward with smaller punches again.
Absolutely. Guys, did you have any more questions before we take another call?
Well, I think there are different schools of thought on it. There are some other prominent doctors, such as Hassan and Wong. Recently, they said that FUE has surpassed FUT. They say the quality of the grafts are now better than that of FUT.
I don't believe that.
So
why would how does that make sense? That's complete bullshit. If you could, and I'm sorry, Dr. Anderson, I know you're not used to hearing me.
No, I don't believe that either. But go ahead.
I mean, the reality is, if you're able to dissect grafts under, you know, under a three-dimensional situation, under a microscope, you really have the ability to, you know, create beautiful grafts, especially if you have someone skilled doing it, as opposed to essentially doing a blind procedure. Now, I'm not saying that the blind procedure can't create great grafts. We know that it can. But I do think that you have greater potential of having less transection if you're doing FUT. You also have a 100% greater potential of being able to utilize 100% of the sweet spot of your potentially DHT-resistant hair with FUT, which you don't have with FUE. So anyone who's saying anything different to me is bullshitting. And listen, Victor and Jerry, they're both IHRS members. I love them. They've been working with me for 20 years, but they know I tell the truth on the show, or at least the truth as I see it. Thoughts, Dr. Anderson?
But then again,
no, I think certainly in terms of patient demand.
Kill off some of the graft.
Say it again?
To remove that piece of scalp. When you cut that piece of scalp out, like about half an inch thick or so,
yeah,
you're going to kill off some of that graft.
Well, you can if you're not really careful. Go ahead.
Not only that, when we stitch the wound up, sometimes there could be dead spots there, and that's I don't know the medical terminology for that, but that's what some people
How many dead spots do you think there are with FUE? Like this is a very old argument that you may have heard it on in old forum posts, or you might have come up with it on your own.
Yeah, I have.
But the fact of the matter is that when a donor strip is removed via FUT, if it's done properly, where the surgeon can see in between those follicles in the scalp, you can avoid the vast majority of those follicles and not create any sort of transection. And you also have to keep in mind that all of the hairs inside of that tissue that's being removed, they're untouched by that blade. Whereas with FUE, you have direct physical contact with each and every follicle that's being removed for implantation. Direct contact. You don't have that with FUT. Every follicle inside that strip is virgin, untouched until it gets under the microscope, and you got such a stronger field of view using the microscopes for dissection on a strip than you do on any level with FUE, and like I've seen it too many times. It's a fallacy that was a big argument on forums many years ago. And specifically to your point, when it comes to the stitching of things, or in some cases the stapling, the percentage of hairs, well, the likelihood of hairs being damaged are also lower because they're not going down into down to the depth of the bulb with the staple. And with sutures, it's such a fine piece of material that's going in between those follicles. It just doesn't have any sort of impact on the donor or the survival of follicles.
That's exactly
I've
right.
never seen it.
Yeah, you basically want to stay within 1.5 follicles with your purchase with the suture, and you do not purchase and when I say purchase, that's how much you grab with the suture itself. You don't want to get the entire thickness of the dermis in there. That will affect the blood supply of that. I want to just make a comment about how FUT is marketed, if I may.
Yeah.
You always see it marketed where the hair is trimmed down, like the guy is going off to Fort Benning, and he's going to, do his basic training.
It's a good point.
and there's the scar. Not many people wear their hair trimmed down like they're going to boot camp. Like I wear the hair the current style it's at. Spencer, I can see it's generally hair that covers the scalp. That's one of the reasons we have hair. If you look at where the FUT scar is placed, it's placed kind of higher up on the head. So it's not near the nape of the neck or right above the ears. It's, a couple of inches above that. So in order to cut your hair short enough to see that scar at all, you'd have to really go military with it. The other thing I want to point out is that on all human heads, where that scar is, the hair is coming down over it like a waterfall at all areas, and the degree there is anywhere from, I've seen as low as 16, 17 degrees up to about 28, 30 degrees or so, and that's a pretty acute angle. And so it's not like the FUT scar would ever be seen if you're getting out of the pool or the hot tub or the lake, or if it's windy out or whatever, or if a person puts their hands through the hair. To find it, if it's done correctly, it should be almost fairly difficult, and you got to comb up through the scalp, kind of know what you're looking for and go looking for it, as opposed to a lot of these advertisements where, and they show these unfortunately large scars. Most of the time they should be 1 or 2 millimeters. If you use the trichophytic technique, you can have hairs growing right through the scar, and they can be frankly hard to find. So it's just funny the way and it's unfortunate the way it's marketed, because I think it skews the perception in the public's view.
Doesn't it depend on the person and the way how the person scars? For instance, Caucasians, when they have a wound and then they have a scar, they don't have this collagen buildup, whereas for Asians and African Americans, they tend to scar badly.
Well, you guys have more. Are you Asian?
Keloid buildup. Yeah, I am.
Okay, so
I know
there's a greater
fact
chance of
that
keloid
when I-
scarring for sure, but this is all something that you're going to put into the equation when you're speaking to your physician.
Yes, but you do have a good point. Typically, the darker the skin, the thicker it is. And typically, the thicker the skin, the more obvious a scar will be. Like if you consider a blepharoplasty, of a lower lid, the scar from that procedure, which is a lower lid eye surgery where they take the bags out from, if you're a little older and that's an issue for you, that scar is left right on the face. But that's the skin of the eyelid is some of the very thinnest on the body. It's less than 1 millimeter thick. The scar is almost imperceptible. The scalp is like a biological helmet. The dermis of the scalp is 4 to 8 millimeters thick, sometimes even thicker, and so which kind of makes evolutionary sense. It's got a lot of blood supply, which is good for to decrease scar formation, but there is a lot of thickness to make up for. So you're going to get some of the thickest, and unfortunately, sometimes even with absolutely perfect surgical technique, the scars can be a little bit wider than planned. However, without proper surgical technique, certainly what you're describing, if you can imperil a lot of follicles if you place the wound under very high tension with the closure, and that just comes from inexperienced surgeons or with poor technique. But by and large, with experienced surgeons, with hair of any typical social length, you would never see the FUT scar, and I think it gets a lot of bad press, unfortunately. But you brought up a good point in that people with darker skin tones can tend to scar a little bit thicker, and so when I see those patients, I always do or perform on the wound what's called a trichophytic technique. It's a little bit of a technical move where it forces hair follicles to grow right through the scar. Good point, though.
All right, man. Listen,
yeah, and another thing is, yeah.
All right,
my plastic surgeon.
We're going to take another
told me
call,
that
dude.
I could never have a facelift because of bad scar formation.
I'll let you finish this thought. Go ahead.
Or somebody like me.
Say it again.
So yeah, I mean, people scar differently, and some people scar more badly than others. I know for a fact, for somebody like me, if I would have to have that linear scar on the back of my head, it's not going to look good. It's going to be wide.
And maybe, and you may have made the right move for yourself. But I've actually seen keloid scarring from FUE, believe it or not. I don't know if you've ever seen that. But that is it's a rare thing. You see it online, and it's just like, what the F? No one warned these people that was a possibility. Now, it's unusual when you have a punctate wound to scar that way.
Sorry.
Go ahead.
And I was going to say, don't forget that when or you may not even understand this, so you wouldn't forget it, but when you have, say, a 3,000 graft FUE procedure versus a 3,000 graft FUT procedure, the overall surface area of the wounding is vastly larger with FUE. There's a lot more surface area of actual wounding into the skin than there is with FUT. And like Spencer was saying, that keloid formation is not exclusive to the FUT environment. It's exclusive to being cut. It doesn't matter what kind of cut.
Mm-hmm.
If you get cut, then you have the potential for some sort of keloid scarring. But also keep in mind that there has to be a history of it. Like it doesn't just show up out of nowhere. There should be, like any physician should be asking you if you do have a history of keloid in the past. Like anytime you get cut, do you heal normally, or do your scars? It doesn't even have to be keloid, but do your scars tend to be a bit bigger than an average scar? Things like this.
That's called a hypertrophic scar. That's a good point, Joe.
Yeah.
All right, buddy. Listen. Good luck. I really, fingers crossed that the second time around is a better experience. The fact that you had you're grading the first one as a C, I consider you pretty lucky. So there's a really good chance you're going to come.
Having a little bit more here, there should improve the appearance.
Yeah, there's a good chance you're going to have a significant improvement.
Yeah.
Okay.
All right, buddy. Good luck.
Right.
You know what? And let us know how you do. Feel free to call anytime.
Take care, bud.
Take care now.
Bye-bye.
Bye-bye.
Thanks for calling.
888-659-3727. We have time for another call or two. Hey, you're on the air. Who's this, and where are you calling from?
Hey, what's up, guys? I'm on the air.
Yeah.
Yes, you are.
Hey, what's up, Joe? What's up, Spence? It's Brother Coop.
Coop, what's happening, man?
Yeah.
Hey, Coop.
I'm not quite Morty, but I like to have fun with you guys.
Well,
hey, great shows, man. I swear to God.
Say it again?
You guys do awesome. I said great show. You guys do an awesome job.
Thank you, man. I appreciate that. So what's
All
up?
right. So I had a couple questions. One of them is like a confirmation question.
All right.
I'm at 6 months plus 13 days post FUE, and I happen to be African American. You guys talked about keloids, and the other guy talked so much I kind of forgot some of the questions I had. Yo, I swear to God, I'm sitting here like, oh damn. So I called, but the good thing is when I called, I put it on speaker and I turned off YouTube, and I could hear the show live. It was great.
That's good.
I didn't know that happened. So I guess I want to hear you guys tell me, because I need to hear this. I'm 6 months, and I'll be 6 months and a half. After that, does new hairs pop out? I've heard it from other people.
Oh, yeah.
Doc say it, or you guys chime in on top of Doc.
Yes, absolutely. You know, what happens with a hair transplant procedure with either method performed is the hair follicles, they're cut off from the blood supply. That, you know, for however long it takes for them to be processed, trimmed, and then reimplanted, usually an hour to 3 hours. Now, that's a bit of a shock to the system, to each and every hair follicle. Now, I mentioned earlier in the program how hair follicles have cycles, but they are not all timed. It's asynchronously happening to everybody all the time. Their hairs are shedding and producing new hairs, or their follicles are shedding their hairs and producing new hairs. When a transplant is performed, it's all at one time. And so all of the hair cycles are kind of truncated or shortened right there. Maybe they're only 2 years into their 6-year cycle, and what will happen is it kind of resets the cycle because they've been cooled off in the tissue bath, and they're starved of oxygen a little bit. When they're reimplanted into the scalp, there's a little bit of a micro damage from being cooled off. There's a bit of micro damage from what's called an oxygen reperfusion injury that involves free radicals, and then
That's a new word, reperfusion.
Yeah, it's an oxygen reperfusion injury. And what can happen is, and what does happen to about 80% of the follicles is that they will shed their hairs mid-cycle. And then they go into their dormant phases. Now, it's important to understand that the dormant phase varies among hair follicles. And so it's not like how I counsel my patients, I say, when the hairs grow in, and they usually, you'll hear 3 months thrown around a lot. It's not like they're all coming in at once like a beard, where they're all going to be the same length and they're all growing. It's the opposite of that. I use the term asynchronous, or not timed. Typically starting at month 3, you'll get a little bit of growth of some of the follicles. This guy over here and this one over here are starting to grow.
Sorry to interrupt, but that word asynchronous has it's a trigger word for me.
Oh yeah.
I'm a teacher, so we did a lot of online asynchronous type of thing. So
okay. Well, sorry to trigger you, brother.
out of any different context, that word would have been fine. But I'm like, oh damn.
Okay.
That applies here.
Yeah. Oh yeah. So all right, I'll just say not at the same time.
And you teachers are easily triggered, by the way.
You know what I'm talking about too.
What was that?
If you're a parent, you also know what asynchronous is coming out of COVID.
Oh my God.
So anyway, to finish up at 6 months, it's not. Bottom line is that the hairs will start to come out. The follicles start to produce another hair after a transplant, anywhere from 3 to 15, sometimes 18 months. I tell my patients most of them are going to have hair grow right up until about 12 months, occasionally 15 months, and rarely 18 months. But somewhere in there, there's going to be about a 4-month period where a bunch of hair grows. Sometimes it's, if it's early, it's month 3, 4, 5, and 6. If it's later, it'll be month 5, 6, 7, and 8, or even later, 8, 9, 10, and 11, things like that. But at 6 months, no. I mean, I'm with my own patients, I'm not willing to kind of put the gavel down until 18 months, because I have had patients come in and they said to me directly, Dr. Anderson, I was not happy at all with the results at 12 months, but it's been 18 months, and man, you're the man. Thank you so much. and they're very happy about that. So I would sit tight. Don't stress. It's give it at least 12 months, if not 15, and occasionally, again, rarely, 18 months. But yeah, 6 months is far too early to call it a final result.
I see. If my man Mike Pedroza is still in the comments, he always tells me stay cool in the pocket. But I kind of knew that, but it was never broken down that way. I almost assumed that if a hair didn't grow within the first 6 to 7 months, if you didn't see it pop out the skin, it's likely that hair survived the procedure.
Yeah, man. I have to say that that there's a look. There are averages. And there are guys who will see a majority of their hair popping through at 6-8 month mark, and then start to grow into terminal hairs. But as Dr. Anderson stated, I've known guys who really they thought they had a final result at 9 to 12 months, and then within a few months their hair looked a lot thicker. So part of that is the hair is maturing. Part of it is new hairs are breaking through that they didn't even notice were breaking through, and then all of a sudden it's kind of catching up in the growth cycle, and you're starting to see little areas starting to fill in. There's no hard and fast rule. There's generalities. There are the basics, but you're at 6 months. So tell me, are you unhappy at this point?
Yo, I'm so close. Oh my goodness. So there, April 3rd, I woke up in the morning and I said, if it doesn't get any better, I'm good. April 10th, I was like, So I fluctuate throughout the day. But in all honesty, compared to where I came from, and I hate to make that the baseline, but from where I started, it's night and day.
Yeah, but that's a good baseline. Jesus, most people don't even say that. The fact that you already believe, or you look at yourself and you're like, it's night and day already at the 6 month mark, that's a pretty positive sign, to me at least.
Yeah.
Absolutely. Yeah. I concur.
All right.
All right, man.
I needed some confirmation, that's all.
All right.
I appreciate your time, man. Take another call.
All right, you got it.
On the right track.
You got it, man. You sound like you're doing well.
Stay strong, man.
All right? We'll talk. Feel free to call in any time. Take care.
Will do.
Bye-bye. Peace. Let's take another call before we call it a night.
We got the time.
All right. Hey, you're on the air. Who's this and where are you calling from?
Hey, this is Eddie from Houston.
Eddie from Houston, what's happening?
Hello,
man?
Eddie.
Hey. Okay, I'm glad you guys answered. So I'm okay. So where I am right now with my hair is that I've had 3 surgeries, and I don't. Okay, so they've all been FUTs, and the 3rd time I had the surgery, it was to try to close up the scarring in the back. And
how old are you, first of all?
I'm 50.
Okay, when did you have your first surgery?
45, I believe.
Okay, so you had 3 surgeries within a 5-year period.
Yes.
Okay.
So I've talked to you guys before, and right now I'm just not satisfied. It's like it was the 3rd time it was closing up. It was closed up, maybe about 90%, but then it's slowly opening, like spreading farther apart.
So you're having some stretch back.
Yeah, and I don't know if is it something I should be concerned about? Is it something I can do to prevent it to get any worse?
I'm going to let Dr. Anderson field this since there's a doctor in the house today.
Yeah, and especially if so what do you recommend, especially if coming back, maybe doing a FUE in the scar area?
Well, let me ask a question. So you had 2 procedures. In the 2nd procedure, did they basically take the scar out and then reapproximate 2 pieces of hair-bearing scalp to leave you with 1 scar after 2 procedures?
No, they didn't take. The 2nd procedure was to take out the scar and take out some more grafts.
Okay, so they did. So, and then the 3rd procedure, in the 3rd procedure, were they trying to get any grafts at all, or were they strictly trying? Was that a scar revision strictly?
They wanted to get grafts out also.
Okay. Well, I think I mentioned earlier in the show the skin of the scalp is the thickest on the human body, and it tends to produce thick scars. When I do a scar revision, or when anybody does a scar, any facial plastic surgeon does a scar revision on the scalp, if it would be considered a success if we can get only a 25% reduction in the thickness of the scar. Now, it doesn't sound like you had a scar revision, though. Okay, it sounds like you had 3 hair transplants. And so you have a number of options at this point. If you're not happy with the width of the scar, I would make sure you're waiting. It takes a full year, really. Scars technically always mature, but it takes a full year for sometimes 18 months for that scar to be in its resting position and resting size. At that point, you could perform or have performed a scar revision where nobody attempts to get anything more than just the scar tissue itself, and then close it under a lower tension in the hopes that you don't get stretched back as much. And again, in that context, a 25% reduction in the height would be considered a success. And then what you could also do is remember, you did mention FUE into the scar. That is an option, but I also want to point out that you've got scalp micropigmentation as an option as well, because what makes a scar obvious, with a linear scar obvious with shorter hairstyles is the fact that, it's a linear line that's lighter in color than the surrounding skin because of the lack of hair follicles. So SMP, or scalp micropigmentation, in the right hands, experienced hands, can really decrease to sometimes 80, 90%, sort of a rough visual gauge, the obviousness of any scarring, and allow you to wear shorter hairstyles. But for those listeners out there, understand, scars are by definition permanent. There's no such thing as a scarless surgery, and frankly, if you're not creating scars, you're not even doing surgery, and you cannot perform a hair transplant surgery without making a scar of some sort. But in terms of a linear scar with stretch back, that can be an issue, and I alluded to that earlier. Sometimes it's just, even with perfect technique, some patients can get a little bit of stretch back, but I would give it a year and then consider one of the 3 options, either a scar revision strictly without trying to get more follicles, FUE into that scar, perhaps even with a combination of scalp micropigmentation to aid in camouflage.
Does your facility offer those services?
Absolutely.
And the SMP? What is
yes.
called SMP?
Yep, scalp micropigmentation.
Yeah, I hate to go. The scar is definitely improved compared to what was before.
Okay.
The first time was horrible. I mean, it was just absolutely horrible scar.
Okay.
I don't know, maybe 5 millimeters. That's pretty wide, right?
That's not optimal. I've seen a lot worse. Just it's hard to know without seeing the scar, and frankly, putting hands on it. When I do a lot of virtual consultations from around the world, frankly, but unfortunately, many times, especially if the patient's in the United States, I'll say, hey, this is, if you've had prior linear surgery, and actually if you've had prior surgery of any sort, that requires an in-person physical exam. And in your case, I would want to feel the mobility, the remaining laxity or mobility of the scalp itself. I'd also want to just kind of take an assessment of how dense that scar is, how much is due to excessive scarring, how much is due to stretch back from overproduction of collagen. So there are a couple of variables at play, but I would, prepare for a visit to someone's office, and it would be a difficult thing to assess over a virtual consultation.
Sure. And how long do you want me to wait for that? How long do you want me to wait for that before they assess me?
A year.
So 1 year. Okay. So it's been about almost 6 months.
Okay. You're going to be roughly at about 80% there at 6 months, but definitely there are changes. The scars mature by the body continually lays down collagen and resorbs it, constantly laying it down and resorbs it, and the scars kind of tighten up and get smaller, kind of like, and they get more dense, kind of like if you had a wet towel and you wring it out. it gets smaller and denser. That kind of process happens slowly, technically forever, but almost all of it occurs in the first year, 14 months. So I would give it a solid year. In the meantime, you could do anywhere after 3 months. You could do SMP into the area if camouflage is an issue. You could do that and temporize the situation, for the remaining 9 months or so that you're waiting on for the scar to mature.
So anything in the interim, I can do as far as like supplements or avoid certain things, exercising.
No, unfortunately, nope. Scar, that's just going to happen. The scar maturation is an automatic process that your body is going to handle. I always recommend. I recommend everyone take vitamins. I mean, the food these days isn't what it could be. So I think multivitamins are good for that. I would encourage everybody listening to take a multivitamin. I know I do.
Actually, I got to start doing that Centrum Silver stuff.
Centrum Silver.
I was telling Joe that the other day.
But no, there's nothing you need to specifically worry about. I would maybe get a consultation for SMP if the obviousness of the scar is a problem. If you have longer hair and the scar isn't really being visible, then I would just wait it out until for that 12-month mark.
Yeah, I'll wait it out. That's fine. I mean, I know when I grow it a little long, it gets sparse. I mean, you can see it if you're looking. I mean, maybe I'm just a little bit more subconscious, but I mean, it's something I'm willing to wait for a year at least.
Yeah, it's definitely a wait-and-see situation, like Dr. Anderson said.
Yeah.
It seems like you're in a better position than you were prior to this last procedure, so that's good. And
is it possible that you can thin again after each surgery? Like I noticed my hair is still thinning, and I don't know if finasteride is enough for me. I'm taking
great question. Yes, you can continue to do hair transplant surgery until there's no donor area left. However, finasteride may not be enough for you. The finasteride may be taken orally in combination with a topical finasteride minoxidil product, in combination with low-level laser therapy, and then, frankly, serial PRP procedures. Some patients have more aggressive hair loss than others, and in the name of really preserving the hair that you have, we do multiple things for dental decay. For the dentists who ask me, they're like, well, I don't really want to do all that. What one would you pick? And I kind of chuckle and say, well, you're like, imagine your patient's coming in. Does anyone say, hey, doctor, I don't want to floss my teeth, or I want to do one thing. Should I brush and forget about flossing, or just come in for cleanings and don't floss or brush? So if anybody who's had 3 hair transplants, I would put the pedal to the metal in terms of hair loss prevention, so that, because what you don't want to end up, in a situation. There's a Kleenex box in my clinic for patients who visit me, who are at the end of their rope. There's no more meaningful amount of follicles to transplant, and they're very upset about that. And some of the, it's difficult to see a grown man crying about it. But
should have a bottle of Jack Daniels.
Oh well. It is a medical center.
Yeah.
But I would just make sure you're doing everything you can, and consult with a qualified hair restoration specialist, a hair transplant surgeon, about your preventive needs. Because if you tell them you've had 3 surgeries and you tell them your issues, if they try to sell you another surgery, that's a huge red flag. You need likely to be doing more to prevent future hair loss, to minimize lifelong the number of surgeries and the number of follicles that need to be transplanted.
Sure. And which office are you? I noticed you have 2 locations. Which one are you at?
Yes, my website is atlantahairsurgeon.com. I have an office in Alpharetta, Georgia, and one in Sandy Springs, Georgia. They're about 15 miles apart. I spend my time at the Alpharetta office. It's at the Avalon for the locals in Atlanta. But for those who are closer to downtown and Buckhead, Dr. Lee, who's very qualified, board certified, and a member of the IAHRS, is in Sandy Springs.
Who do you want me to talk to when I call in?
Talk to them, whoever answers the phone, but I think it's Kirsten or Jesse. But yeah, make an appointment with me. I'd look forward to speaking with you about it. Yeah.
All right, man.
Great.
Well, listen, good luck to you.
So much. I really appreciate your help.
All right, you got it, man. You take care.
Thanks.
And let us know how it goes. And when you call in, make sure you tell them that you called the Bald Truth.
Okay.
Yeah, make sure. Yeah, please do. Please remind me you're Eddie from Houston.
Yeah, this way they're not going to fuck with you.
Well, no, hey,
I'm just kidding.
Come on, man. They're gonna fuck with No one gets effed with at my house.
That's
a serious subject.
You would not be in this studio if that were the case.
It's a serious subject, Spencer. Come on.
All right, man. Take care.
Yeah.
Good
All
luck.
right.
Bye-bye.
You too. All right. Bye-bye.
I had to bring his spirits up a little bit, guys. All right, so Dr. Anderson gave out his website. It is AtlantaHairSurgeon.com. Obviously, he's a member of the International Alliance of Hair Restoration Surgeons. You can find his profile at iahrs.org. He's also one of a handful of hair transplant surgeons who get a recommendation from the American Hair Loss Association and board certified by the ABHRS, diplomat of the ABHRS, also a fellow of the ISHRS, and honestly one of the few guys that I allow into my home and into my studio. Dr. Anderson, I want to thank you for taking the time to be here, and it was great, man.
Thanks, bud.
We had a full board because of you.
It's nice having you on the air.
Well, it's a pleasure to be here. I'm very flattered by your comments. But, yeah, wonderful studio, man. I always really enjoy visiting you in Los Angeles.
No, I appreciate that,
You got
man.
it, buddy.
It's always good to see you. Joe, I'm going to let you give out the websites, my man.
Right on. Well, as we said, Spencer said just a few minutes ago, AtlantaHairSurgeon.com is Dr. Ken Anderson, accepted member, International Alliance of Hair Restoration Surgeons. So great to have him with us today. The other websites, speaking of IAHRS, there's IAHRS.org. It's a safe place to start. No doctor's perfect, but a lot of these doctors have great credentials and great experience and have your best interest at heart, so you can at least talk to them about what your options are. That's International Alliance of Hair Restoration Surgeons. There's also AmericanHairLoss.org, the American Hair Loss Association. It is the de facto standard for big media. When they're writing about hair loss or hair restoration, they will quote or reference American Hair Loss Association to validate their own article. It's a huge thing, and we're talking GQ Magazine, New York Times, Wall Street Journal, the echelon or the upper echelon of big media. That's AmericanHairLoss.org. If you're listening to this broadcast on iHeartRadio, iTunes, you can also watch us live here on my YouTube channel. It's youtube.com/Hair Transplant Mentor. It's my YouTube channel where I also have my hair transplant class series where I'm talking about the ins and outs of hair restoration surgery, what you need to know, and also doctors that I feature that are also IAHRS accepted members become Hair Transplant Mentor members. There's also my personal website, hairtransplantmentor.com. You can check out my personal story, my journey through 10 hair restoration surgeries, and to where you get this wonderful mop of hair after being a formica with pluggy grass sticking out. Yeah, it was bad. Anyway, what else is there? Oh, also the UK version of The Bald Truth. It's The Bald Truth UK with Spencer Speck Stevenson and Spencer Kobren, only found on aidtogentleman.com. Great website, not just for hosting The Bald Truth, but also great men's styling tips and articles and all that good stuff. So it's a big website in the UK. Check it out. That's aidtogentleman.com. Back to you.
And did you thank some of the guys that are actually putting the program on their website for us?
I forgot. Sorry, I did not. And I was chatting with him actually because he had a question earlier. That's hairlosscure2020.com. It is a great website if you're particularly interested in hair loss treatments, both current and future. He has a lot of interviews and articles about companies and doctors that are working on the cure for hair loss, as it says in the name. That's hairlosscure2020.com. Check him out.
All right, Joseph, thank you so much for that. Until next time, guys.
Yes.
Be strong, God bless, and thank you so much for listening. Have a good night.
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the program, and I'm glad you enjoyed it. And if you could now leave by the exits at the rear, that'd be splendid. Thank you.